Chairman, I can confirm we're now live.
Thank you very much indeed. Thank you. And good afternoon and welcome everybody to this meeting of the Bracknell Forest Local Outbreak Engagement Board. Right, firstly, do we have any apologies for absence? Or no, actually, before we go to apologies, perhaps I should just say, Kirsty, are you happy to take the attendees from the screen, or would you like to go through the roll?
Happy to take them from the screen, but preempting your next question, I have received apologies from Councillor Del Birch and Tessa Linfield.
Okay, thank you very much. So we record those two. And of course, if anybody does have difficulty getting on, we will, because of technical difficulties, we will record their apologies. Moving on, do we have any declarations of interest, please, colleagues? Nope. Okay, then that's fine, and the usual caveats apply regarding direct declarations of interest. Should any conversations take an unexpected turn, please feel happy to interrupt in order to make them at any appropriate time. And Kirsty, do we have any urgent items of business under agenda item 3?
Yes, Chair, I understand that the officers have some additional data they'd like to share with you, but this will be integrated into the existing presentation item, so it doesn't need to be a separate item.
Okay, that's fine. Always happy to have late data. Right, so that takes us to agenda item 4, the community and schools lateral flow testing. Kelly Williams, I understand you're going to introduce this, is that right?
It's actually myself, Chair Charlotte Pavitt, that will talk to this item. Okay. No problem.
Fine, thank you. Sorry to have worried Kelly.
So we just felt it would be useful just to give a brief update on the data and numbers, just to set the context before we move on to the testing. So let me just share my screen with you. Is everybody able to see that?
It.
Okay, there we go. So here's the updated data for this last week. This was updated earlier on today. So this looks at the cases and testing for the week between the 7th and the 13th of January. You can see Bracknell Forest is the top line here. Our testing rates per 100,000 continue to increase, and we saw 537 individuals tested per 100,000 over that weekly period, and we have continued to see a reduction in the percentage of individuals of all of those tested who test positive, our positivity rate, and that gives us, as I've said in previous weeks, us an indication of community transmission that's occurring within the borough. So positive that still continues to decrease. In addition, we've seen a 32% drop in the number of weekly cases, all ages per 100,000 population, and that currently stands at 479.8. When we look at our vulnerable population, the over 60s, that too has seen a 24% drop in the last week and currently sits at 378 cases in the over 60s per 100,000 of that population group also. As I mentioned last week, there was a dip in testing, the numbers that went to get tested over the Christmas period, and that will have some impact on this reduction in cases that we're seeing. If there's less individuals going to get tested, we're going to identify a lower number of cases. However, the continued decline in cases is positive, and when we look and compare that to our neighbouring areas, again that's being seen across the patch, but the reduction that we're experiencing is higher than our neighbouring areas, and it's bringing us back in line and actually below the southeast case rate per 100,000 in all ages and in the over 60 population. I just wanted to demonstrate that in terms of the graphs, because that's sometimes easier to see. You can see the sudden increase that we experienced prior to Christmas, just as we were entering into what was tier 4 at that time, and then in hindsight the knowledge that that was probably down to the new variant that was circulating, which is more transmissible. It's easier to pass on, it's easier to catch. Since the end of the year, we have seen this reduction, and as I've said, likely to be a result in some part due to the reduced numbers of testing over the Christmas period, but we're hoping that that continued decline in the cases in the blue line will continue to be seen over the next week. It will be the next week that's really key to understand whether that's a true downward trend or whether that's the testing numbers driving that. And you can see in our counterparts, there is a decline right across the board, bit of levelling off, but West Berkshire is significantly lower than the other areas anyway, but that's being seen across the patch. What I did want to do was highlight a note of caution in this. We are seeing a reduction in cases. However, our case rate is still just shy of 500,000 cases per 100,000 population. And when we compare that back to wave 1, you can see down here where the rates were around sort of the highest level it got to in mid-April was 49 cases per 100,000. We've still got a long way to go. Now, there will be a certain amount of ascertainment bias here. We weren't testing to the levels that we are now, and therefore we weren't seeking to identify the number of cases we are now. However, there's still a long way to go to bring it back down to the levels that we were experiencing in wave 1, where intervention was, in terms of the first national lockdown, was put into place. So we need to continue to keep doing what we're doing in terms of adhering to the lockdown and the measures that are imposed upon us. As part of the action to reduce community transmission, we've now started to ramp up our testing programme. And testing is one of the number of measures that we've got to use. We've got our communication strategy that we're continuing to adapt and to get the messages out so people know what is required of them in order to curb the community transmission. We've also got the enforcement approaches and the use of our COVID marshals and our work with the environmental health team and also Thames Valley Police in order to enforce those messages. And we've also got our local contact tracing service as well. But in addition, we've now got a number of national programs, and I'll talk about the schools national program in a minute, as well as our community testing that the local authority have ownership and responsibility for. So in terms of the community testing, it's using the lateral flow devices, or lateral flow tests, or LFTs as they're sometimes referred to. It's a very similar process to the normal PCR testing process. So when you go for a confirmatory test, when you're experiencing symptoms, you go for what's called a PCR test, and that gives you the result in order to know whether you need to self-isolate or not. The lateral flow test is conducted in the same way. We use a cotton bud to swab tonsils and nostrils. However, the processing of the results is much quicker, between 20 to 30 minutes. And what that test detects is the amount of virus, or the viral load, that the individual is carrying, and the higher the viral load, the more likely the individual is to be experiencing symptoms and also to pass the virus on. So that test, there are limitations in terms of its sensitivity and specificity, or accuracy, we might want to call that, in comparison to the gold standard PCR test. However, we trade that off with the quick turnaround time in which it can be done. And what we are confident of is that a positive result in a lateral flow test is likely to be true, and therefore we will be picking up more individuals that we would have otherwise not been aware of, and we can advise them to self-isolate accordingly. So this test will be available for individuals who are asymptomatic, who haven't got any symptoms, and that's currently a group of the population that we're not testing at the moment. So in terms of the aims of this community testing, we're looking to identify, as I've said, asymptomatic individuals. A positive test means that they can then self-isolate, and we can then reduce transmission or the risk of an outbreak. Initially, we're going to target our focus on individuals who are going out to work and who can't work from home during this lockdown period. And we've mapped out what that looks like, whether that's internal to the local authority or organisations that we work alongside or commission, as well as the wider private sector within Bracknell Forest. We've then undertaken a prioritisation process where we are prioritising those who are coming into contact with the general public most frequently and who have the most close contact with the general public as well. And individuals who are in contact on a frequent basis, constantly throughout the day, in very, very close contact, those will be the staffing groups that we prioritise first. And we will go down step by step as through the entire workforce in a phased approach of rolling this out. We've been working very closely with the military planners, the team within public health, and the COVID response team within the council to identify who those target groups are, and that we're also working with our communication engagement colleagues in drawing up the communication plan to start communicating this programme of work more broadly and out to the relevant staff groups. So I'll just pause there. In terms of the work programme, we are at the point where we will be submitting our proposals for approval by the Department of Health with a view to start implementing, as I said, in a phased approach, starting with a couple of sites to start with and building on those as we go through in the coming weeks. But first sites, all being well, that sign-off comes through by the end of the month. I'll move on to testing and I'll take questions at the end if that's okay. So in addition to the local testing programme, there are also a number of national programmes for testing, and these include staff testing across the NHS, includes the testing that's already underway within care homes in terms of care home residents and staff, and most recently we've had school testing programmes being introduced. The first programme that was introduced just prior to Christmas and implemented in the new year was the secondary school and colleges testing programme. And this, again, an aim to safeguard the health of the teaching workforce and keep as many as staff and pupils in school and college as possible. It has two elements to the programme. It has what we call our case finding, where we undertake weekly testing of staff and initial testing of both staff and students when they first come back into the school environment, with a view of identifying any asymptomatic individuals and advising them to self-isolate and removing them from the school setting to prevent any outbreaks. The second element is around a daily testing program that can be implemented where an individual is identified as being a case, and then rather than advising the close contacts or the bubbles that they've been exposed to self-isolate alongside them, there is the option to use the daily testing in replacement of isolation. We have, however, discussed this at the East Berkshire Health Protection Board, and we're not alone. This has been also discussed in other local authority areas. We've come to the decision that given the online provision of our schools that's in place at the moment, and also the level of the rate, the high rate that we're experiencing in terms of COVID infection, that we don't and we wouldn't advocate the serial testing to replace self-isolation at this time. We're constantly working with the Department for Education and having discussions with our peers across Berkshire to review this position on a regular basis. But at the moment, we feel that yes, in terms of using testing to identify cases and to then take them out and isolate is positive, but the daily testing in order to replace self-isolation shouldn't be used at this time, and the schools are aware of that and are supportive of that approach also. And then finally this week, the latest announcement by the government was that we would be using the lateral flow device testing programme within primary schools and nurseries from next week. And so the programme for primary schools and nurseries focuses on asymptomatic cases within the workforce only. So this is only staff, this is not children of a primary school age. And the proposal is that staff will undertake these tests at home. So it won't be the same school provision that we're seeing in secondary schools. Staff instead will undertake twice weekly swabbing, and should they test positive, will have to then book on for a confirmatory PCR test and self-isolate accordingly. So we're currently working with our primary schools to start getting that set up in terms of ensuring that the tests are available for them, for their staff, for home use. And I'll pause there for any questions.
Thanks very much indeed, Charlotte. Thank you. Colleagues, are there any questions? Wow. No questions? Okay. Then thanks very much indeed, Charlotte. Thank you. I think that's it then. So thank you for explaining that so well. And I'm sure that we can all have copies of those that presentation if that would be helpful.
Yeah, that will be published for everybody.
Okay, great. Thank you very much indeed. Right, thank you everybody. And then we'll move on to item 5 on the agenda, which is public participation. Kirsty, do we have any questions from members of the public?
Not for this meeting, Chair. I'm not aware of any questions being submitted to the committee Dropbox.
Okay, thank you very much indeed. Then all that remains is to thank you all for your participation and attendance today, and to remind you that our scheduled next meeting date is the 2nd of February. So look forward to seeing you all soon, and thank you once again, everybody, for your participation today. Thank you.
Thank you, Chair. Thank you.